Hello, and welcome to the first installment of Understanding Epidemiology. I'm your host, Alan Dubitsky, and today we'll be discussing the topic of endothelial function of the heart. So you may ask yourself, what does endothelial function mean? Endothelial function pertain to the endothelial cells which are found in the inner lining of the blood vessels of the heart and the blood vessels throughout the body. In today's segment, we'll be discussing Dr. Vona and her team's study at the University of Geneva in Switzerland, which pertain to different types of exercises that affect endothelial functioning in patients that have experienced an acute myocardium infarction, which is commonly known as a heart attack. The purpose of this study was to analyze the three types: aerobic, a bit of weight and resistance, and a combination of both, and see which one would benefit the patient the most. As previously stated, the participants that were tested during this study had a myocardium infarction happen 3 weeks prior to the conducting of the experiment. With this in mind, the scientists segregated the participants into 4 groups: the control group that did no exercise, the resistance group that did just light weight bearing training, the aerobic group that did just light cycling on the stationary bike, and the fourth was a combination of both. The participants were involved in exercise 4 times a week for 40 minutes for 4 weeks, which included 10-minute intervals for break and for cool downs. Among the 4 groups of participants that were used in this experiment, there was a few very interesting results pertaining directly to the endothelial function, and secondary sources which did not directly pertain but were still associated, so let's discuss them. The heart rate, the blood pressure, and the peak VO2 max among all 4 groups was relatively the same with no change, and there was a slight increase in the left ventricular contraction of the heart among the trained group, which is very understandable with the blood needing to go into the muscles being worked. But the significant differences were the right brachial artery diameter increase in the biceps, which is very significant among the trained groups. The von Willebrand factor, which is a blood glycoprotein, which helps in the prevention to stop bleeding in the blood cells, decreased 16% among trained individuals, which is the biggest find of this experiment. And the fibroblast dysplasia, which is abnormal growth in the artery, also increased significantly among the trained groups. To close off on, all types of exercise, whether aerobic, resistance, or a combination of both, will help in endothelial functioning of the heart. But most physicians and scientists will recommend aerobic physical activity as there is more intense research done and it is proven to decrease mortality rates, unlike resistance and combinational training where there's not much.